It's tips time. Welcome to Training Intervention Program for Behavior Change. Tips for Behavior Change. I am your psychologist and behavior specialist, Geraldine Garwood. Please remember to subscribe, like, share, and click that notification bell to know when a video is uploaded. Today I'll be doing adolescent stage of development, and this is my final series in childhood stages of development. Please remember to check out my videos on infancy part 1 and 2, early childhood development, and middle to late childhood development. So, what is involved in adolescent stage of development? I want to look at a couple statements that were made about this stage of development. Mark Twain says, when a child turns 12, you should put him in a barrel, nail the lid down, and feed him through a knot hole. When he turns 16, plug the hole. This is Mark Twain's view on adolescent stage of development. And what he's trying to say to us is that this is a turbulent period for adolescents. And so when they turn 12, you should prepare yourself as parents, guardians, caregivers to expect that they will be going through a challenging period. You may not want to see them around. You may have a difficulty communicating with them. This is how he presents his depiction of what adolescent stages of development looks like. Now, Sigmund Freud, known psychologist who have contributed to developmental stages of children, he said that adolescence is a temporary mental illness. This one is really funny. So, what Sigmund Freud is saying is that during adolescent stage of development, these adolescents or these teenagers are crazy. They are crazy. They do crazy things. As I want to move on to the third statement, which is my favorite statement of all, and it comes from G. Stanley Hall. And he says that adolescent stage of development is a time of storm and stress. So basically, the adolescent is under construction. They are going through a rough period as they understand what is happening with the changes in their bodies. So I like G. Stanley Hall's, depiction of what adolescence involves. Now, what is adolescence? We may want to know what is involved. Adolescent stage of development is from age 12 to 18, and some developmental psychologists take it to 21 as well. Now, adolescence is a time of many changes, both for teens and their families. To ensure that teens and adults go through these changes successfully, it is imperative that there is a common understanding of what is happening to the adolescent physically, cognitively, and socially. Very, very important that both the adolescents, both the adults in that space understand exactly what the teen is going through in that stage of development. So these are some expected difficult behaviors. These are some behaviors that we should be looking out for from our adolescents. They are called expected normal behaviors, normal difficult behaviors that our adolescents should display when they are going through this phase. Moodiness, less affection shown to parents, greatly influenced by peers, preoccupation with sex, masturbation, very occasional experimentation with cigarettes or alcohol, even other substances as well. Extremely self involved. They become self conscious and they are involved with cliques. They form little cliques. Some may even get involved in gangs, but I'll get to that a little later. So, what is happening with the adolescents? There are some things that happen with their body. So their body change. So the adolescent is saying to us, my body will change as they go through the phase. My body will change. And so we will see that they will go through what we call puberty. And what exactly is puberty? Puberty is a period of rapid skeletal and sexual maturation that occurs mainly in early adolescence. It signals the end of childhood. So when puberty starts, this is saying that my childhood is over. And this is why adolescent stage of development becomes what G. Stanley Hall depicts, a period of storm and stress. So the onset of puberty for boys is on average 11.5 years, while for girls 9.5 years. Boys are usually taller than girls. So what we see here is that girls tend to enter puberty stage earlier than boys. Now, early and late maturation. So we have what we call early adolescence and late adolescence. So in early adolescence, they are keen on attaining new and more mature relationships. They begin to realize a masculine or feminine social role. They accept their physique and begin to use their body effectively. And they begin to gain emotional independence from parents and other adults. And that may occur between ages 12 to 14, 15. Late adolescence, they begin to prepare for serious relationship and family life. Yes. And they prepare for a career. They start thinking, um, where will I go to college? What career will I enter? That's where their thought process is. They begin to attain a set of values that will guide their decisions and behavior. And they desire and achieve socially responsible behavior. And late adolescence, we see that occurring from about age 16 to 18, 19. As I say, some developmental psychologists take the adolescent stage to age 21. So physical development, what is involved in physical development as our children go through adolescent stage? Development of secondary sex characteristics include growth of pubic hair, underarm hair. So you will see that. Growth of breasts in the girls. This is the first reliable sign of puberty in girls. Broadening of shoulders for the boys. Menarche, which is the first menstrual period for girls. Normal time, age 9 to 16.5. And for the boys, they will have penis growth and they will have spermarche, the first ejaculation during sleep, which is called nocturnal emission. And then the boys will have changes in their voices. There will be changes in skin texture, facial hair growth for boys, growth of body hair, increased production of oil, increased sweat gland activity, and the beginning of acne. So during adolescent stage, yes, you will see the adolescents with acne. Some of them have severe acne. It can be treated. You take them to the right dermatologist so that they can get the proper skincare to treat their acne. Nutrition, very important across the developmental stage. Very, very important that our children have their fruits and vegetables and, and lots of water so that they can maintain proper diet and nutrition. So, during puberty, teens have great need of greater quantities of food to take care of the bodily growth. And so there's an increase in appetite. Yes, they eat a lot during that stage of development, as well as the stomach increases in capacity to digest the increased amount of food. Nutrition is essential to facilitate the attainment of maximum height, strength, and physical well being. Deficiency in nutrition, very, very important for the adolescents, may result in emotional instability, premenstrual tension, and lower resistance to infection, reduced stamina, and physical and mental retardation. So it's very important that our adolescents have a well balanced diet, and this is critical for all developmental stage. Now, death. The leading cause of death in adolescents are accidents, homicides, and suicide. A sense of hopelessness will cause adolescents to take the easy way to them out, which is taking their own lives. Adolescents are also involved in accidents, especially when they violate parental rules and take out their parents' vehicles, or they will go to parties with their friends. They may use substance and they may get drunk from alcohol usage and they may get involved in an accident. Homicides, that's another key thing when our adolescents get involved in gangs or cliques, if for wanting of another word, they can end up in situations that become fatal for them. This leads me to drug and abuse. Some of the things that our adolescents engage in: nicotine and tobacco, alcohol, heroin, marijuana, and even some of them engage in using prescription drugs. So, drug abuse is a widespread in adolescence, especially smoking, drinking alcohol, and use of painkillers. These are examples, but this is more prevalent among our adolescents: smoking, drinking alcohol, and using painkillers. And this is globally. Substance dependence is also evident in adolescents, because what happens, they will start out taking the drugs as a form of experimentation and then they become dependent on the drug. Alcohol, marijuana, and tobacco are considered to be gateway drugs. Therefore, parents can play a preventative role in their adolescents becoming dependent on substance. Adolescent sexuality, very critical. Sexual maturing is a main feature of puberty. Teens may feel awkward about demonstrating affection to the opposite sex parent. At times, teens may ask more direct questions about sex, and parents should answer. Communication is critical during this time between parents and their teen. Many teens lack information about sexuality. They will have feelings of love and passion, development of more serious relationships, form a sense of their sexual identity. And the developing of sexual identity involves mastering emerging sexual feelings, understanding his or her sexual orientation, and the kind of interests, activities, and style of behavior he or she gravitates towards. And sexual orientation is a topic that is uncomfortable for most parents to engage in with their adolescents, but this is something that you should bring up as you communicate with your child as they begin the puberty stage, as they go through this period again of storm and stress. The communication must be open, and as parents, guardian, you should engage your teen and let them feel comfortable and assured that they can talk with you about anything, any challenges that they are experiencing. Emotions. And so we go to their cognitive development, their thoughts and emotions. Now, the characteristics that are involved in their cognitive development is that the adolescents during their stage of development, yes, very critical one, they become very argumentative. They can also be indecisive and they tend to find fault with authority figures. Yes, and they find fault with teachers, they find fault with parents, they find fault with a neighbor who have an interest in their well-being. Intellectual interests also expand and gain more importance, right? So these are the characteristics that are involved in adolescents' cognitive development. Decision. Decision making is critical to this stage of development because at this stage of development, they must make some important decisions. But I believe that these decisions should be guided by responsible adults, persons again who have the adolescents' best interests at heart and want to see them master and achieve their goals. So they should be guided in making responsible decisions. Peers. Peers is very important for adolescent stage of development, also for middle to late childhood stage of development. And so peers are strong influences during adolescence. Some become victims of peer pressure and strong peer influence. Adolescents usually become members of cliques where they share ideas and hang out together, and crowds based on reputation. Friendship is of great importance to adolescents. A lot of pressure is placed on intimacy and close friends. It is important that parents and guardians know their adolescents' friends, know where they go, where they hang out, who they hang out with, because friends play a critical role in their development. This is a stage where adolescents want to belong, identity versus role confusion, and they want to belong. And so they can gravitate to negative peer influence or positive peer influence. And so it is very important that the adult in that adolescent's life is there to give guidance, is there to know their friends and to point out when they are going in a wrong direction that is not best for them. Moral values. As you talk about peers and friendship, moral values is important because when the adolescents know what is right from wrong, then they will have greater capacity for setting goals for their own lives. They will develop an interest in moral reasoning. They will build up their capacity to use insight. There will be increased emphasis on personal dignity and self esteem, and they will embrace some social and cultural traditions that they value and like. So it's very important that moral values are discussed with the adolescents so we know where the headspace is at, that they develop these moral values so that they can become more responsible and positive adolescents as they go through this stage of development. Risk taking. Our adolescents like to take risks and they engage in some risky behaviors. And these are some of the behaviors that they will engage in that you are to look out for. Dangerous dieting that will lead to eating disorders like anorexia, and bulimia, using drugs and alcohol. I talked about that earlier. Running away, staying out all night with friends, engaging in unprotected sexual activity, getting involved in gang violence, using weapons, bullying, or scapegoating. They will engage in stealing behaviors. And so these are some alternatives to risky behaviors that the adolescents will engage in. Get them involved in lots of physical activities such as sports, the creative arts. Engage them again, I can't emphasize this enough, in open communication, talking about sex with them. Let them volunteer and participate in community service program, student exchange program, so that they can seek out new friends, learn from other people. If possible, get them a part-time job, and as stated earlier, and get them involved in community activities, community development. That can help develop their social and moral character. Also, it can help them to understand even their own self. When they see what other adolescents are going through, they can be able to become a positive role models to other to children in their community and other adolescents as well. So some tips for parents on this stage of development. Educate yourself about adolescence development. There are lots of information on adolescent stage of development. Read, educate yourself. Talk with them about the changes that they will experience during this time. Create an atmosphere of respect, trust, and honesty. So create an atmosphere where your teen feel respected by you, and the same, they give you respect. You have a trusting relationship. Put yourself in their place. It's very good to share with your adolescents some of your experiences being an adolescent yourself. Let them realize that, yes, I have been through this, and this is how I overcame. And so they can understand that you have been there and you know what they are feeling. Pick your battles. Pick your battles with your adolescents. Very important that you do that. There are some things you don't need to fight with them about. Choose your battles wisely as you engage your adolescents. Please remember to subscribe, like, share, and click that notification bell, and check out my videos on infancy part 1 and 2, early childhood development, middle to late childhood stage of development.